Dr. Tyler Williams, and here today to answer a question that commonly gets asked to us when people find us because they are scared or concerned about saving their teeth. And so people will sit down one-on-one in my chair and ask me, how do I save my teeth? Or I don't want to lose my teeth. Or 5, 10, 15, 20 years from now, I want to keep all my natural teeth if possible. And I think it's a very good way to think, because implants are great, but if you go somewhere that only offers implants, you're only going to be offered implants. Versus if you work with a team that can help you look at options to both save your teeth or replace your teeth, then you have more of an unbiased opinion on treatment. And generally speaking, the teeth you already have are your best bet, so long as they are either in good shape or they can be rebuilt into good shape. Now, some cases they can't, and then we have to do a full mouth where we replace all of your teeth with implants. But if you have something like gum disease or receding gums, or you got a whole bunch of dental work and your teeth have shifted, don't fear. There are a lot of great options for you today, better than ever. And there are generally 5 stages of gum health. So what we call stage 0 means your gums are pink, healthy, they're tight, they don't bleed a lot, they're not sensitive, they don't have pockets, they don't get bad breath easy. And for people like that, generally twice a year, having your teeth and gums cleaned and x-rays and maintained is sufficient and does very well. If you're into level 1, that means you have gingivitis or bleeding gums or infection in your gums. It's not in your bone yet, but it will go that way if it's left untreated. And gingivitis causes sensitivity and bleeding gums and bad breath, and usually it's the beginning of receding gums. So if you're experiencing gingivitis, you want to get that looked at by a qualified team that understands the levels of gum disease. Now, when you get to level 2, 3, and 4, now you are into the irreversible stage. However, this does not mean you have to lose your teeth. It simply means that bone that is damaged or lost will not grow back on its own. Sometimes with bone grafting or laser therapy, we can regenerate your bone, but it's not going to go back on its own. Compared to stage 1, you haven't lost bone yet. So when you get to stage 2, and a lot of times for stage 3, the prognosis is generally very good. This has to do with 2 things. One is the treatment you receive in office. Generally, we use a laser and a water jet and some other non-surgical therapy so you can save your teeth. And it may take a few visits, but we can get you on a healthy track so that you can have those teeth for years to come. If you don't do that kind of maintenance, then eventually you'll end up in stage 4. Stage 4 is more difficult to treat because that's when your teeth get loose. There's lots of receding gums, lots of bone loss, to the point where it's an uphill battle to save your teeth. And ultimately, that leads to stage 5, which is hopeless tooth loss. Your teeth are sitting on the foundation of gums and bones, so getting those healthy first is important. And then you can make your teeth look just like implants, or straighten your teeth, or fix the crowding, or whiten your teeth, or replace old dental work and make them look however you want them to look, be it looking very natural or how they used to look, or making them really stand out and giving you that Hollywood smile. And there's no right or wrong answer. Really, it's a personal decision. But this is where the intersection of health, functionality, and long-lasting come together. And those are the 3 areas we look at with your smile: is how do we make it healthy? How do we make it functional to chew and eat? And how do we help you have it last for a long time? And if that's a cosmetic fix where you want them to look good for you and other people for a long time, that's great. If it's more of just you want them to last a long time so you don't lose your teeth, that's also great. So if you have some more specific questions, check out our other videos, or you can give us a call. Our contact information is below this video. Love to go over some questions with you. We do have some limited copies this month of a free book that I published on this very topic, and love to share a copy with you. So thanks for taking a minute to watch this video, and we look forward to seeing you on the next one. Have a wonderful day.